Hello, my name is Ida Piri, and today I'm attending the Breast and Cervical Cancer Coalition workshop right here in Lusaka by World Economic Forum. This is in collaboration with the Zambia's Ministry of Health and Global Alliance for Women's Health. Here is the background.
I understand the profound impact cancer has, not just on individuals, but on families and communities. We are here today to delve deeper into breast and cervical cancers, beyond the medical jargon and statistics. It's about breaking down barriers that prevent women, and in brackets men do get breast cancer, from accessing the care they need, or we need, and deserve.
Could be your mother, could be your granddad, could be your brother, could be your sister or your baby daughter, could be on anyone, so it does matter.
Hi, my amazing people. So today is day 2 of the World Economic Forum workshop concentrating on breast and cervical cancer. And join me is Catherine from MD Anderson. So Catherine will tell us what MD Anderson is and the collaboration that they have with Ministry of Health and of course the Zambian Cancer Society and just Zambia at large. Hi, Catherine.
Hi, my name's Kathleen Schmaler. I'm a gynecologic oncologist from MD Anderson Cancer Center, which is in Houston, Texas, in the United States. Really excited to be back here in Zambia. We've been working with the Zambian Ministry of Health and with the Cancer Diseases Hospital, as well as with the Zambian Cancer Society and others here for several years. We're here to bring more awareness to cancer and the treatment of cancer, and that many cancers are curable, for example, cervical cancer. So we do a lot of work in the area of prevention as well.
Okay, thank you very much. And we're so glad with the help and the collaboration that you are doing here in Zambia, because it really helps us to put our picture where cancer is concerned at another level, because we really need the expertise and all that. So just in one line, tell us who MD Anderson is. That's number 1. And then number 2, what you think of the cancer picture in Zambia currently.
So MD Anderson is, all we do is a hospital just for cancer. It's very, very big. I think the largest certainly the largest in the US, maybe in the world.
You have to brag about that.
We have 26,000 employees, and our whole goal is to eliminate cancer, not just in Texas where we live, but in the world. And so a lot of the work we're doing here is on training and education of nurses and doctors. There you have so many great medical providers and especially advocates here in Zambia. So I think the picture is very good. We're excited for you to be getting new and improved radiation therapy, and we'll be helping with that, as well as a lot of the prevention and advocacy activities you have here.
All right, okay. Thank you so much. So you have heard it for yourself. Thank you very much, Catherine, for coming here in Zambia and all the help that you're giving, the trainings that you are giving our oncologists, because we don't have enough capacity, and you have really helped us to build capacity and just increase the number of medical health providers here in Zambia, and we truly appreciate you. And please, as you go back to the US, render our gratitude to MD Anderson. Please join me as I talk to more people, and let's learn more about what's happening today, the workshop that is being conducted right here in Lusaka. This is World Economic Forum in collaboration with the Zambian Ministry of Health and Siemens Healthineers. Come with me. I'm with Dr. Albert Kong right here, and he's also traveled here in Lusaka to attend the workshop that we are concentrating on breast and cervical cancer. Dr. Kong, why do you think this workshop is important today?
Yeah, we're super excited to be part of this workshop here today, and to work with the country of Zambia, and in particular Cancer Diseases Hospital, to help develop the very first high energy linear accelerator center in the country. From our perspective, we look forward to partnering with the folks at Cancer Diseases Hospital to train the radiation oncologists, the physicists, and the radiation technologists to deliver state-of-the-art radiation oncology care for the patients of Zambia.
Thank you so much. So just look into the camera and just give one word to a cancer survivor.
I'm sorry, one word.
To a cancer survivor.
There's hope.
Okay. Hope is the way. Thank you. And now I have Julie Maziga from Kenya, who is communications lead, and she is going to tell us what it has been to organize this workshop. Hi, Julie.
Hi, how are you?
Good, thank you. How are you?
I'm so good.
All right. Okay. So I know this was a big workshop with people coming from different parts of the country, different parts of the world. Actually, how has it been coordinating, communicating? Because your communication skills are up to par, my lady.
You flatter me. Well, obviously, it's quite a production putting this whole thing together. So I'm mostly on the communication side. So mostly about thought leadership, making people aware of the Coalition for Breast and Cervical Cancer at the World Economic Forum, with our partnerships with Ministry of Health Zambia, Siemens Healthineers. So my job is basically to raise awareness, make some noise in the town square about both breast and cervical cancer on the continent, and then to show how the World Economic Forum is coming in to bridge the gaps where governments need a bit of support from private sector.
Okay. Yeah. So you know why I'm super excited to have her right by my side? Because she does what I do. I do what she does. We're both in communications.
Do what she does, we does. We all do.
Whatever it is, we does. We does. All right. And what's that one thing that you love about communications?
I love storytelling. I love being the person who gets to listen to all the experts talk in their technical terms and then break it down and then make it accessible to the ordinary man and woman on the street, because we all need information, but sometimes it's so difficult to engage. So that's the most exciting bit. And obviously I learned so much about different things around the world that affect women specifically, around women's health and the women's health gap. And that's exciting for me, of course, being a woman. So the best bit is storytelling. So it looks like being in communications, you can go from one side of the camera to the other one. So I get to be the interviewer now. Either you're also in communication. What's your favorite thing about being a communicator?
Oh, wow. I thought I was going to ask you that question, but anyway. One of my favorite things of being a communicator is that you connect people, you bring people together, and just the fact that you're able to break different information into smaller bits and then be able to connect and translate the message to other people. It's super amazing. I really love it when I'm raising awareness and people understand what breast cancer is, like lay people understand what signs and symptoms are, and like I can communicate, use my skills to raise funds and support those that need the help the most. I just love it.
Fantastic. We're so on the same page. Lovely answer, Ida. Thank you all.
Thank you. Thank you. All right. Okay. Thank you very much. And thank you for being here. Please travel safe back home.
Thank you so much. So welcoming and hospitable, and I'm thankful.
Thank you.
Thank you. Bye.
I'm joined by the initiatives lead, and her name is Emily. Hi, Emily.
Hi.
You are rocking that duku.
Oh, this is like probably the most beautiful accessory I think I've seen on females in Zambia since I arrived in the country. So congratulations for such a wonderful idea to raise awareness for breast and cervical cancer here in Zambia.
Thank you so much. So we raise awareness, we raise funds, we help build self-esteem, support those that have lost their hair due to chemotherapy by wearing dukus, these head wraps that you're seeing here.
Yeah.
All right, so let's get right into it. What have you enjoyed the most about our 2-day workshop focusing on breast and cervical cancer?
Yeah, it's a really good question. So on behalf of the Global Alliance for Women's Health, I am, very, I would say, proud to have, convened the key experts within the health ministry here in Zambia, with technical experts, civil society, private sector organizations and other public sector organizations working in this space to ideate on potential solutions and a path forward to help improve and make progress against the National Cancer Control Plan. And to your question, what have I enjoyed the most? I have enjoyed the most, really seeing how the power of private-public collaboration, and how, when you bring together persons within this space who have the insights, the experience, also people from other countries, and you bring them together and you get them to focus on, a specific topic, and to see kind of what, great ideas and solutions and possibilities come from that. So I've been very humbled by that, and a huge thank you to the Cancer Society.
Thank you.
For also attending our event, for also contributing to the meaningful discussions, and also making sure that we are held accountable going forward. Because we have created 4 task forces here today to work on specific topics and subjects, and we really, we take that role very seriously to make sure that we continue our collaborations with organizations like yours here in Zambia.
Thank you. So, speaking on behalf of the Zambian Cancer Society, we are so privileged and we are happy to be part of such conversations, because really that's our mission. It's helping us drive what we believe in, because no one should face cancer alone, and each one of us needs someone as you walk through the cancer journey. So this is something that we really, really appreciate and we love doing, and we are so privileged to be a part of this conversation. So Emily, how can you summarize our 2-day workshop? What happened? And for someone who didn't attend physically, how would they know what happened through what you're going to explain?
So I think to answer your question, we came here with 3 very clear objectives. To, number 1, understand the barriers, enablers, for the National Cancer Control Plan and the team at the Ministry, and get that first-hand view of, what the challenges are and what the gaps are. And then number 2, to, collaboratively plan on ideas and solutions to drive a change and drive progress. And then also 3, we came to foster partnerships, internally and globally, between these organizations who've been invited to contribute to, the future of cancer eradication and cancer elimination in Zambia.
Okay. So do you think you've achieved your objectives?
Yeah, I think today was, the first of many more meetings that we will have with the Ministry and with our partners. I certainly think we achieved in terms of the expected outcomes. We wanted was to walk away with 3 to 5 ideas and solutions that we can build a task force on, and really work together to drive commitments and drive progress. So yes, I think we achieved what we set out to do today.
I'm so glad that you've at least met your objectives. You should be going back happy, right?
Yes.
Okay, so what are your last words?
Parting words today would be to the women in Zambia, the mothers, the aunties, the sisters and the daughters, as well as the husbands and the brothers and the uncles out there, to know that breast and cervical cancer are the leading cause of death amongst women in Zambia today. To take that seriously and, get screened, get your vaccination, your HPV vaccination, and when it comes to the time of your life where you need more breast cancer screening, to really be proactive about that. We really want to improve the lives of women's health globally. That's our mandate at the Global Alliance for Women's Health, and we want to see Zambian people and organizations taking ownership of that responsibility to promote and prioritize and protect women's health. So yes, to all of you women, thank you for a very productive meeting. Thank you for being involved. Yes, I'm truly humbled by your talent and expertise, and really the your willingness to work towards this goal here in Zambia.
Okay, thank you so much, Emily. That's a wrap. for our Day 2 Breast and Cervical Cancer Coalition workshop right here in Lusaka by World Economic Forum in collaboration with the Ministry of Health in Zambia and Global Alliance for Women's Health. Thank you very much for joining us. Until next time, bye.